Yes, I actually have two questions, if that's okay. I guess my first question would be, can you just tell me what is going to be different specifically with the permanent site compared to the interim site that's been operating this past year? And that question's for anybody, whoever wants to answer.
So again, I guess they may be crossing over a couple different portfolios. So who would like to start?
I can start if you want, and then Violet, I probably won't give a full answer, so I'll just ask you to chime in. So kind of just from a physical location perspective, the interim site was on the second floor, and there is no elevator in that building, so it was not accessible, unfortunately, for the last year. And so that's going to be a major difference. With the permanent site, it is fully accessible, and we'll be able to support people with any mobility issues. Further, the interim site pre-COVID had 2 consumption booths, so it had the capacity to serve 2 people using substances at the same time under the care of medical staff. And in the permanent site, that has now increased to 5. So 4 kind of standard booths, 1 accessible booth. And then in addition to that, we have a private consumption booth, which is in a separate space altogether and is monitored through a live feed to the nursing station. So that's pretty unique. And that's a vast increase in terms of capacity and the number of clients that can be cared for at one time. And then in addition to that, there is, as you couldn't tell, from the video, it was actually missing a bit of audio, so you didn't hear Violet's wonderful voice explaining all of the different rooms. But on the main floor, there will be a primary care clinic room, as well as an assessment room, which will be able to be used for things like mental health support counseling, quiet space for people who might need to have a conversation away from people. And then on the second floor, so once we have, now that we have the consumption space on the main floor, the second floor can be dedicated program space as well, which will include a large meeting room to do things like workshops, counseling meetings, all of those types of things, as well as space to have different community partners come on site and provide services on site. And then in addition, as I had mentioned before, the laundry facilities and the showers will be a wonderful addition to the site overall. Sanguine staff have made this site what it is. And now we're just going to have more of those folks being on site at one time, which is just going to be awesome. So I'll stop there. Violet, I'm sure you have other things to add.
I don't have a single thing to add. That was perfect. Capacity is really the biggest part that we're looking forward to right now. With COVID, we have not been able to be at our full capacity in terms of client flow through this space and people being able to access services in a really timely way. So we're really looking forward to being able to work with people significantly faster and to see more people coming through the space. And all the rest is great.
Great, thanks. And my second question is also open to everyone. I know we touched on Cambridge a little bit, but Cambridge does have the highest rate of overdose calls in the region. And I know council has not made a decision yet. They're still waiting, but I just want to hear from the experts. Do you think Cambridge really needs a site right now because of what the city's been struggling with?
So I'll just jump in there and I'll talk a little bit about the rates of overdose. So our overdose numbers are based on 911 paramedic services calls, and those actually do fluctuate. So, the rates of overdose changes in terms of areas being most impacted. And I'm not sure that Cambridge right now kind of is at the top, but it does fluctuate over time. So as I had mentioned before, when we had conducted the feasibility study back in 2017, the end of 2017, early 2018, we did identify 2 areas of significant need in the region. One was in downtown Cambridge, Galt, and the other in the city of Kitchener. the need still exists. So we continue to publish heat maps of where we continue to receive 911 paramedic services calls. And those two areas continue to be areas of higher need. And so, as I mentioned, we continue to have conversations with City of Cambridge staff and support them in working through, what things could look like in their community with respect to harm reduction as well as other services.
Okay, great, thanks. I just wanted to say that I got those numbers from the OMARS website, and according to the municipal rate, Cambridge is at the top right now, but I know that Cambridge and Kitchener will often switch places there, so thanks.
So looking around the room, I see Heather has her hand up from CTV. Heather, are these questions related to the CTS, or is this for COVID related questions? We'll kind of do those at the very end. Can you unmute yourself, please?
Sorry, I'm not used to actually speaking in these. I'll do the other questions after. Yeah, so these questions would be related to this.
To CTS?
Yeah.
Okay, go ahead. Okay,
and my apologies if I'm like repeating something that someone else already said. It's just kind of to isolate it. So this question would be for anyone who wants to answer it. I guess just in general, since it opened, do we have any, I mean, I know that you showed like the chart of like people, the number of visits going down and things, but I mean, just in general, do we have a scope of like actual numbers on how many people are coming these days? I'm not sure if like there was actual numbers for that.
Yeah, I can speak to that a little bit. So, so over the COVID period, so kind of starting in March, we began to see a downturn of number of visits, and then April we saw a lower number, and that was around between 300 and 350 people that we were seeing per month at the site. Whereas pre-COVID, we were seeing upwards of 850, 900, 950 people per month. So it is a significant decrease in the number of visits to the site per month, and in direct relation to the pandemic.
Okay, and I guess just in general, I know the answer to this, but I'm going to ask anyways. How have you felt about how the temporary site has gone thus far?
Would Violet like to answer that, perhaps?
You know that feeling right before Christmas or your birthday or, any of those big occasions? That's what every day at the CTS is like. It is, as Elena mentioned when she was speaking earlier, it is a phenomenal place to be. It is a warm, welcoming, happy place for people to stop in. A lot of challenges, a lot of things to figure out as we've gone along. And I think it's been wildly successful in doing the things that we set out to do. So the interim site is smaller. It's different from the big site, but that's the vibe that's going to carry through. It's a very positive space and a lot of good things are happening there.
I guess, yeah, because just to clarify, the interim site was just the second floor, and now the permanent site will be both the main and the second. Is
Yes.
that right?
Yes.
Okay. And so I guess it's obviously something that is needed and will be hopefully well utilized, and everyone seems to be really excited for this, right?
Definitely.
And I guess what's the most exciting part about it, I guess? Why is everyone so excited about this?
So the increase in capacity is a big part of it. Being able to work with more people more effectively with more space. I mean, all of those things are fantastic. To start bringing our partners on board, to have more services available in the building because we have that additional space that's just a fantastic thing that we can add into the work that's already being done. I think, it's an affirmation of the work that's being done now and the need for it to continue working and to have that space available to clients, to the community. It's all good.
And I know the answer to this again, but I have to say it just so I can isolate it. Tell me the people that will be on site, the type of staff that will be there at the permanent site daily.
So our core staff, we have 2 registered nurses, a social support worker, 2 peer workers for all of our staff, for all of our shifts. We also have security, and we have a supervisor on site as well.
And tell me how it works when someone comes in.
So they come in through the front door and they check in at reception. If it's their first visit, they sign their consents. We make sure that they understand the rules and all the requirements of them, so their rights and responsibilities. They then fill in a brief assessment form that we provide to our nurses so that they know what to expect from that person around health issues, around the substance they're using, or any additional services that they require. Once that's been completed, as soon as there's a space open, they'll be escorted into the consumption room, assuming that they're there to consume. And they'll be observed by the nurse, who provides some education around safer substance use, around harm reduction, around, anything that the client has indicated that they have concerns about. So that could be a health issue, wound care, vein care, pretty much anything that person is telling us that they need. We're going to try to find a way to help them with it. After they use their substances, they'll be observed for overdose or for overdose risk. If the nurse assesses or evaluates that that is a potential risk, we'll continue to monitor them and respond to that overdose if it's required. And then from there, they move into post-consumption, where they meet with our support worker and our peer worker again to have those conversations, to continue building relationships and trust, and to make sure that people feel comfortable within the space. And then if we need to refer to an on-site service when that's available, we'll do that, or we can provide a space for people to have a quiet conversation, to make some phone calls, to do whatever it is that they need to do while they're there, and then welcome them back if they're ready to come back again.
Mm-hmm. Okay, and also for whoever wants to answer this, 68 people lost their lives to suspected overdoses this year in the region. Is that right? That's the number, right? I guess how do you feel about this, and is this one of the reasons why something needs to be done?
Violet, do you want to, or go ahead, Grace?
Sorry, I can start, and Violet, or anyone else, if you wanted to add on to this piece. So yes, it's devastating to hear that 68 people have lost their lives. And when we talk about statistics, and if for those of you who remember the presentation when the interim site opened, I think we took some pause and just reflected on the fact that 68 people who've lost their lives in 1 year, it doesn't mean that loss and that grief stays at that particular point in time. Those losses are felt for years to come. And so, collectively and over the last number of years, we've lost hundreds of people to this crisis, and those losses continue to be felt today. Sorry, my phone is ringing. So I think to your question, to Heather, this is one part of a harm reduction strategy to address fatal overdose. We are going to, sorry about that. It's one strategy to address fatal overdose in our community. And, we know that, as shame and a stigma continues to exist around addiction and drug use, that shame will mean that people are hiding their drug use and puts them and are using alone and are putting them at higher risk for overdose. And so it's really, really important, to talk about the CTS, talk about the wraparound services, make facilities like this as welcoming as possible, and to show people that this really is a health issue, and that they can gain support for, and that they can get access to other services that they might need to help them be healthier down the road.
Okay, so Heather, I think we'll move on now to another media partner. I see Casey from 570. Casey, are you here to speak with us or just to do the recording? She's good. Okay, so I do know that Kate's on the call from CBC, but Kate, did you have any questions about the CTS, or are you here for a COVID conversation?
I had another reporter who was covering COVID, and he was listening on the YouTube feed. So
Okay.
he said he was okay. My apologies, but did we touch on Cambridge at all? And are we touching on Cambridge at all today about whether or not that's going to move forward now that we have a new counselor in place?
I think that we talked a little bit about Cambridge. Grace, if you want to summarize.
Yeah, and so I can talk a little bit about what we know. So at this time, City of Cambridge staff are leading their process around CTS and had put that process on pause while that by-election occurred. And so, we will continue to work with City of staff as needed, and we'll be there to support that process when that starts up again.
Great, and whether I can ask you, Grace, or Violet, just how staff are feeling at the site to have a permanent location now. Again, you may have already addressed this, and I apologize for that. But I mean, to make that next step into permanency, if that's a word, how does it feel?
It feels fantastic. I mean, I'll speak on behalf of all staff because I know it's unanimous. Everybody's excited to be moving into the full space. It's fantastic. I don't know, maybe Elena wants to add something as one of the staff members, but it's great.
Yeah, so I feel super excited. We all feel really excited. And like Violet had said previously, I think the most exciting thing is that capacity piece, that we can have more people coming in, have more opportunity to have those conversations and build those connections, because it's been hard with decreased capacity with the pandemic. So super exciting. Yeah.
Okay, so I am going to do sort of a last call for questions about the CTS from our media partners. So we're going to reduce the size of this group one more time so that we can ask Dr. Wong a couple questions about COVID. So if you want to stick around, you're welcome to stick around, or you can pop out of here as well, but we'll ask Dr. Wong to stay on with our media partners. Carl, I'm going to ask you to check the waiting room, and also I think that we can probably we'll keep the YouTube stream going in case some of our outlets need to use it. We'll keep that going for now, actually. Okay, so I know that that we had some questions about COVID just going into the weekend, and since we didn't get together this week, we thought we'd take this opportunity right now just to be able to chat with you briefly. So Kate, did you want to go ahead with your questions first?
Yeah, and hello, good morning, everyone. Thank you, Julie, for flagging to tell me to get in here. Dr. Wong, I wanted to talk to you about Thanksgiving, obviously, and in talking to people, myself personally, and through our newsroom, it really sounds like they're hearing the message not to do Thanksgiving, but they don't care. They're like, well, these problems are in Toronto, they're not here, we're not seeing the cases here, and they're still planning to go ahead and have, well, I'm going to use my bubble and I'm going to do this. So I'm wondering what your message is to the people in the region who are just saying, you know what, it's not so bad here. It's Thanksgiving, we're going to see family.
Yeah, thanks for the question, Kate. So I think what we're seeing across the province is an escalation in the number of cases. And although we're not seeing the same rate of escalation at this moment in time, we are than places like Toronto, Ottawa, Peel, York, etc. We are also seeing an escalation, and I think we have to remember that the escalation that occurred in those areas that have the highest rates right now occurred quite quickly. And this is a risk that other areas such as ourselves, who have started on their second wave, who have started to escalate, are also very vulnerable to having occur. Sorry, I don't think my grammar was totally right with that, but I think in some, we cannot be complacent because we are in a very precarious situation in that depending on what our residents do or don't do, we could have rapidly escalating rates that could lead to widespread transmission, just like we're seeing in some other areas in Ontario. So it's really up to all of us to try to keep the increases manageable, and even better, to try to slow the rate of spread in our region. So what I'm recommending is that for Thanksgiving, people celebrate in person only with their immediate household. Now, if they have one or two essential caregivers as part of their small social bubble, then they may want to include those people as well. And if people are alone and they want to not be alone, they also can consider joining up with another small household bubble. But in general, please stick with only your immediate family members, your immediate family bubble, and with everyone else, physically distance and mask. And that's what we need to focus on in Waterloo Region. That's what's going to help us slow the spread, because what's happening elsewhere could very easily happen here, and it could happen very quickly here. And the more that we have widespread transmission, the less likely we will be able to use targeted measures to slow the spread. So I would just end there for now.
Kate, did that answer your question, or did you have any follow-ups?
I do have just one quick follow-up, and it's the rise of, I don't want to say necessarily the misinformation, but for public health officials such as yourself, Dr. Wong, and the people you work with, I mean, is it frustrating that we're still here 7 months into a pandemic where people continue to question the severity of what this virus could potentially do?
Well, I think what's frustrating is when we hear of people who know what we're supposed to do and who understand why we're supposed to do it and who don't do it. I know there's also other people that are genuinely confused. And, because what we're trying to do across Ontario, including here during Wave 2, is to take a targeted approach to restrictions if needed, that can lead and does lead to numbers that are different for different settings, right? So I know a common question that has been asked of us is, well, why are you saying only be with your immediate family if I can go to a store and I can go to a restaurant? And so understandably, people are wondering about why there's different limits. And really what it comes down to is when we're talking about only being with your immediate family, it means having that close, unprotected contact where you don't physically distance, where you don't put on a mask. Whereas when you go into, different establishments that are permitted to be open now, there are supposed to be measures in place as per the Ontario Reopening Act in order to enable physical distancing, and now we also have the face covering legislation provincially across the province for indoor settings. So that's really the difference. We are trying to keep as much as possible our schools open, our economy running, our medical procedures running, at the same time that we're trying to keep the rates of transmission low and manageable. So it's more complex than it was during wave one, because in wave one, everything shut down. So, I would say that, during this time, people have some questions. And so, I'm trying to pass the message, and I'm trying to keep it simple, which is for your close contacts, unprotected contacts, limit that to your immediate family bubble. This goes for Thanksgiving as well as for going forward, and for anyone else. Even if you plan to have a gathering that's under the provincial limits of, say, 10 indoors, anyone that's not outside, well, first of all, I don't encourage that right now, even if the limit is 10. But if you're going to do that, the message is anyone else outside of your immediate family bubble, you should physically distance with them. You should wear a mask with them.
You're good, Kate. Okay, so I know you're not usually on this topic, but did you have any questions for Dr. Wong?
Nope, I'm good. I didn't know this was happening, but I don't have any questions. Thanks, though.
You couldn't have known, because it kind of just came up. We had a couple of requests. I know that CTV, so Heather, I'm not sure if you were going to be asking the COVID questions, but I know Daryl had reached out to us to see if we could do this. So did you have any questions for Dr. Wong?
Yeah, I just wanted to know how many questions do I have, just so that I know which one.
So Kate, did you want to answer that? You always do the supplemental. We typically try to stay with 3, but let's roll with it and see where we go.
Okay, so we're just talking, I guess 939, I believe, cases reported in Ontario. So Dr. Wong, we just wanted to ask, I guess, what do you think the numbers are rapidly rising this time around versus in wave one, and like if you could compare kind of the two?
Yeah, so that's a great question, Heather. So we did expect some level of increase as part of reopening up our society, our businesses, our schools, etc. But what's happening in Ontario, in particular, in areas like Toronto, Ottawa, and Peel, is very concerning. And we're also seeing an increase not only in those areas, but in surrounding areas, in the GTA and all the way out here to ourselves as well. We're seeing an escalation. We're seeing the curve go up. Yeah, it fluctuates from day to day, but there's an escalating trend. And in places like Toronto and Ottawa, there's a very steep curve that's appearing, and that's what's concerning. It's more difficult in wave 2 to control the escalation and the risk of escalating into widespread transmission, unless all of us, double down and revert to those precautions that we've been asking people to take, which is, and that we're asking people to take, even more now, which is to limit the number of people with whom we have close, unprotected, prolonged contact to just now, we're asking them to limit those contacts to just their immediate family bubble. Because what we saw, towards the end of the summer and the beginning of this fall, is that more and more people started having close, unprotected contact with a lot more people. So, for example, there's been more outbreaks in areas like Toronto and Ottawa, and they've seen things like, people showing up to work sick and then, mingling with their colleagues and not being distant, not wearing a mask, not taking other precautions. People going to a family gathering or a wedding or a get together with a bunch of other people, sometimes like 50, 100, 200, just mingling around, and no precautions, even though we've asked people to continue to take precautions. And then we've seen in those places, it's spread to dozens and dozens of people. And then if you remember, each person then, because we're in a more open society, most of the time, each of these people to whom it's spread then works or goes to school or both. So if you think about that, that's how it can really grow in terms of number of contacts, right? So it can really spread because of the fact that we've opened up society. There are those precautions in those individual settings that have been put in place, but that's only going to be good if the overall transmission remains low. Because if you have lots of community spread, you're going to have lots of people showing up to work who are infected, in schools who are infected, in long-term care and settings like that who are infected. And then you have to work to prevent further spread in those environments. So it's a kind of a significant escalation in terms of the number of contacts. So that's why we all have to pull together to double down again on those precautions so that we minimize the risk of further spread in those settings. And we can only do that if really keep to our close contacts. We limit our close contacts with others, outside of our family bubble now. And then with everyone else, we practice distancing, we wear masks, and we follow the rules that are in place now, or, that might be updated shortly from the province, in terms of numbers that you can gather with, indoors or outdoors. And importantly, because we're also seeing a relaxation with respect to adhering to this advice, importantly, do not go to work, do not, visit with your friends if you're starting to have symptoms. We've seen that relaxation of adhering to that as well. So, that's why it's really important. How big, how steep our curve becomes in our region is largely dependent on how we all practice those public health precautions.
And, do you think that more restrictions and measures need to be done to be put in place in the region, like possibly going back to stage 1 or 2?
Yeah, that's something, we're trying not to enact if we don't have to, right? Again, these are more broad measures. They're less targeted, and they have significant impacts to other people, to people's livelihoods, to the economy, to also homes. If you have to start to put in more restrictions for people in long-term care, for example. So I am always, assessing the situation locally as well as the options locally. I'm looking forward to seeing what the province might come out with later, based on the stats that they're seeing across the province. But it'll be something I continue to monitor. I did bring in additional measures earlier this week that went a little bit above the provincial requirements currently in place for our region. So I brought in a couple of additional requirements for bars, restaurants, and other food and drink establishments. And you know, there was also the class order that I put in place, and we'll just have to really closely monitor. I am really concerned about what has happened in Ontario, and I think what we're seeing in places like Toronto, Ottawa, Peel really are, you know, a warning to all of us. If we're not careful, we can head down that road as well. And one of the things that's challenging, you know, I'll say this, is sometimes people say, well, it's not that bad yet. But the thing is, we don't want to get that bad, because once it gets that bad, it's more out of control. And when it's more out of control, it will have a greater chance of escalating even further. So you don't want to get that bad. But if you see that you're on a trend, you know, you're on an increasing trend, that's when you've got to make the changes. That's when you've got to put in place, you know, the measures. And right now, the most important measures in Waterloo Region are the measures that we can each personally take, especially in time for Thanksgiving, but even after that. So yeah, so that's what I would say.
And how hard has the second wave hit here so far, I guess, in terms of hospitalization, strain on resources, and do you expect it to continue to get worse?
So we're not like, you know, elsewhere, like in the GTA. So right now, you know, our hospitalization rates are low, but we are seeing more sick people. We are seeing what's known as a higher percent positivity among the tests that are taken. So some people think, oh, we have higher numbers because we test more. No, it's not just that. Among the people tested, even if we're testing more are positive. So we're seeing an increasing trend since the beginning of September in the percentage of people who are tested and who test positive. And we're seeing more people that doctors are seeing, hospitals are seeing with symptoms and then testing positive. And even if our hospitalization rates, which are still low at the moment, we have 2 or 3 at the moment, it can fluctuate. But what we're seeing, again, this is a trend we're seeing elsewhere. And I expect this to happen to our region as well, is that right now most of the growth in the infections is occurring in the younger age groups, right, under 40. But now it's starting to spread in Ontario to all other age groups. And we're starting to see that trend as well. And if that happens and more vulnerable people get it, our hospitalization rates will increase.
I think that's it, I believe.
Okay. Thank you, Heather. Any other questions from our media friends?
I just had that other question that I had said about flu shots, but I think that was maybe after this.
Yeah, I'll get you a response from the vaccine team. Yeah.
Amazing. Thank you.
Okay, so thank you, everyone. We're going to wrap up this power session. Thank you for joining us today, and I hope that you have a safe and healthy Thanksgiving weekend. Take care.
Thanks very much.
Thank you.
Okay.
Bye, everyone. Happy Thanksgiving.
Happy Thanksgiving.
Bye.